This video is on breastfeeding issues. We will examine the different causes of issues, and these can be broken down into either maternal or baby-related issues. Maternal can be related to supply, where there's difficulty in producing or expelling the breast milk, pain associated with breastfeeding when the baby sucks on the nipple, or issues related to initiation, frequency, and duration. So the mother may have issues starting breastfeeding, or they can start but they find it difficulty to sustain or have difficulties in maintaining a suitable time frame. Issues related to the baby usually relate to anatomical abnormalities which make it difficult for the baby to grasp onto the breast and feed. So these can be tongue tie or cleft palate, or any issues associated with prematurity. There are a variety of benefits to breastfeeding, and these can also be broken down into benefits for the baby and for the mother. So for the baby, all the nutrients that the baby needs are provided through the breast milk within the first 6 months. It also confers immunity, as it gives a variety of antibodies and hence reduces the risk of a variety of infections such as otitis media, respiratory infections, necrotizing enterocolitis, which is ischemia of the gut mucosa, as well as preventing or reducing the risk and severity of diarrhea. Maternal benefits: it's free nutrition. It can also act as contraception, so they don't have to use other forms of contraception while breastfeeding, and it can also contribute to weight loss of the mother. There are, however, a variety of risk factors that may cause difficulty in breastfeeding. There may be reduced milk production, and these are related to endocrine causes such as obesity, polycystic ovary syndrome, or preeclampsia. There may be insufficient breast development. This could be congenital or a natural abnormality. However, it could also be because the breast has been removed due to surgery, as well as other endocrine causes such as diabetes or polycystic ovarian syndrome. The breast could be fine, the milk production could be fine, but there could be poor milk extraction from the baby. And this is related to prematurity, if there's weak sucking reflexes, because feeding is not a learned response, it's an inherent natural response, it's a reflex. And that's why the baby can feed immediately after birth. It's also important to provide specific solutions to these issues if a mother presents with these challenges. So to address engorgement, you can encourage expressing the milk before the feed. So you may express it into a bottle and then from the bottle feed the baby. If there is insufficient supply, work on positioning, which we'll cover later, as well as feeding more frequently. If there's nipple trauma, avoid excessive moisturizer. And finally, if there's mastitis, use frequent milk removal. Complications and contraindications include absolute and temporary. So important contraindications include galactosemia, as well as HIV infection. Temporary contraindications include cocaine, as well as herpes, breast lesions, as well as active TB. Management is usually supportive, and it's first important to counsel the mother and make sure they understand that little milk is better than no milk, no breast milk. So if possible, avoid supplementation with formula and stick to the natural breast milk, as well as address any feeding techniques. So the correct attachment and feeding technique is shown in this diagram, where the baby requires a large mouthful of breast, so not just sucking to the nipple. And then the mom must support the baby across the shoulders with their arms free and lie sideways and help them push up against the whole breast. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.